From the Gulf States newsroom, this is the Gulf States Gumbo, your weekly serving of stories from Alabama, Mississippi, and Louisiana. I'm community engagement reporter Elise Gregg, chopping it up this week. This year, Mississippi's legislature will decide how to spend millions of dollars meant to be used to fight the opioid epidemic. If you're listening to this right now, you've probably been impacted by the crisis. Whether it's a friend, a family member, a neighbor, or even yourself, addiction affects us all. Most people are familiar with opioid overdose deaths. It's the most often used data that's talked about. But the opioid crisis doesn't just claim lives. Its impacts ripple across generations, fracturing families and communities. And that's something public health reporter Drew Hawkins was interested in investigating, the impacts on children and families in Mississippi. With the support of the USC Annenberg Center for Health Journalism, as part of its 2025 data fellowship, Drew looked at the data and found that so far, the state has largely not invested in programs that support addiction recovery.
Just over a dozen patients at the Fairland Center in Dublin, Mississippi are snacking on donuts and sipping coffee after a group session. Everyone here is a mom, and everyone struggles with addiction, like Allison Koenig.
I was addicted to heroin. My husband was addicted to heroin, and I found him dead from an overdose.
Koenig's husband, Wiley Koenig, died on Mother's Day in 2020. She and her mother-in-law tried their best to revive him, but they couldn't bring him back.
And then I look over and I see my children watching it too, you know? So it's very, very traumatic. And it's been 6 years and I'm just now really dealing with it in here.
The Fairland Center is one of only 2 residential treatment facilities in Mississippi that admits expecting mothers and mothers with young children. Koenig says she was lucky to get a bed. Being able to bring her youngest son was crucial.
Well, it was either bring him or die. If I wasn't able to bring him, I wouldn't come, you know, because I wouldn't have anybody to take care of him.
Since 2015, over 800,000 Americans have died from opioid overdoses, including more than 10,000 Mississippians like Wiley Koenig. The crisis triggered a wave of lawsuits against opioid manufacturers, distributors, and pharmacy chains. Mississippi is receiving more than $400 million in settlement funds. But the state is far behind most states in spending that money. What has been spent has largely not gone to treatment or recovery or toward children and families. And fear of losing their children keeps many parents from seeking help.
They're not going to reach out to the resources they have because they're scared of what their consequence might be.
Joanne Shedd is a peer support specialist at the Fairland Center. She knows this fear intimately well. Years ago, after her newborn tested positive for drugs at birth, the state placed her son in foster care.
I mean, it was like a death. I mean, that is how I felt when he was taken from me that day.
She eventually got her son back. Many families don't. Parental substance use is a major reason Mississippi leads the nation in infant and maternal mortality and has the highest foster care rate in the Gulf South. More than 40% of those children enter the system because of parental substance use, and fewer than half are reunited with their parents. Many others end up with grandparents. Mississippi has the highest rate in the country of children raised by a grandparent.
We need a lot more resources.
Brenda Foster is lead nurse navigator for the Mississippi State Department of Health's Opioid and Substance Use Disorder Program. She says opioid settlement funds could help.
There are a lot of barriers. If we could just address those and do something with those with some of this money, that would be great.
Other states have used opioid settlement funds to support children and families. So far, Mississippi has not. Spending records tracked by Mississippi Today reporter Alan Sigler found the state has spent less than 1% of the opioid settlement funds on addiction-related programs. Most of the money has gone to things that have nothing to do with addiction, including hundreds of thousands to buy new police vehicles and guns. Advocates like James Moore lost his son to a fentanyl overdose and was part of the council that made recommendation to the Mississippi legislature.
This is not even public money. This is from the greed of the pharmaceutical companies and the distributors and the pharmacy chains that profited off of our loss.
He hopes future spending decisions will focus on treatment and recovery support. The funding recommendations the state legislature is reviewing include programs and initiatives focused on children and families impacted by the opioid crisis. But they're only recommendations. Ultimately, state lawmakers will decide how the money gets spent.
That was public health reporter Drew Hawkins. You're listening to the Gulf States Gumbo. I'm Elise Gregg. One thing that's been missing from the decision-making discussions around Mississippi's opioid settlement funds is input from people with lived experience of addiction. The advisory council that made spending recommendations to the legislature did not have a single person with lived experience voting on applications. That was something we wanted to change. We wanted to bring the voices of people with lived experience to state lawmakers. And that's where community engagement comes in. To talk more about what that means and what it looks like, community engagement producer Nellie Beckett sat down with Tina Apellis from the USC Annenberg Center for Health Journalism.
Hey, Tina, how are you today? Thanks so much for joining me.
Thank you for having me.
So I thought a good place for us to start today would be a big question here. What is community engagement and what does that mean in the context of reporting?
Well, if I can backtrack a little in terms of the history of our center's engagement initiative, which explains our sort of approach to community engagement. More than 12 years ago, our founder, Michelle Levander, wanted to introduce reporters to best practices on ways to engage more deeply with communities. And so with this, we were providing strategies so reporters can uplift community stories and perspectives rather than those of, say, well-intentioned outsiders. So that meant really at the heart of community engagement is centering reporting on those with lived experiences, centering community voices, and in the process, ideally, it will be transformative for reporters in newsrooms, especially in sort of the age where people are sort of disoriented by the media or there's a lack of trust. Community engagements helps to sort of build trust and build bridges that leads to better and more impactful stories. But on a personal note, to me, I think this is sort of part of what I've always done, even though it didn't have a name. And so I think for some reporters I've worked with, they're like, oh, I actually do that. So that could mean a call out, that could mean canvassing. Community engagement really is about, I think you'll hear this a lot from anybody in this space. It's about meeting people where they are and ensuring that sort of the reporting is more relevant to what they both need and hope to see in their news.
Thanks, Tina. So in your time at the Center for Health Journalism, you've mentioned canvassing, you've mentioned community meetings. Have there been any specific strategies or events you've seen that have been particularly successful for journalists to, as you say, reach folks where they're at?
Yeah, there's a lot. And I know some people might be surprised by, hearing the word canvassing. There are many different strategies that have been used by the grantees I've worked with, and probably more ideas to come. But, one strategy that's been really incredible for me is what people term as listening sessions, and emphasis on listening rather. Often reporters can go and asking the questions. And I think in this form, it's really about the listening and having the community lead the discussion. And just to give an example to people, for instance, one of my most memorable and one of the first sessions I helped coordinate was in Crow Nation, where the reporter Nora Maybe was reporting on this significant life expectancy gap between Native American residents and their white counterparts, around 17 years, which is, very shocking. And she wanted to explore how to address that, the causes as well as solutions. And we were able to gather pretty diverse group of people to talk about this. It included some elected leaders, elders, volunteers, and other tribal members from different sort of generations too, to talk about these issues. And while we sort of created that space and that time for them to meet, we really just opened up, with a few prompts and then let them take the discussion where it would go.
This really gets to the heart of what Drew and I have been doing with our project about the Mississippi opioid epidemic affecting children and families with support from the Center for Health Journalism. Listening sessions have been particularly impactful for us. We held one in Hattiesburg, Mississippi, inside a bike shop, actually, owned by
Yes.
James Moore, who's not just a source, but a really respected community leader within the addiction space, to bring people together who span professional experience, lived experience, experience with loved ones. And as you said, really let the listening drive it. Let people lead the conversation. Tell us what's on their mind, what are their concerns. And as you said, the outcome would be to impact legislation. So with this project, we've actually been recording both on Post-its, with audio, with digital feedback forms, just having a multitude of ways for folks to sound off. And we're going to bring that feedback from these multiple community listening sessions to lawmakers in Mississippi. We also went to a residential treatment facility in Tutwiler, Mississippi, and I felt that listening session, or as we kind of called it, a group interview, was incredibly impactful because many of the residents there said no one had asked them about these topics
Exactly.
before.
That's been brought up. Like, thank you for asking.
Exactly. Thank you for asking. It's important to feel like my voice matters. I can tell you what works and what doesn't because I'm living it now. So, community engagement is not just, between the newsroom and the community, but among the community. All right, Tina. Well, this is a perfect segue into a segment that we always do on the Gulf States Gumbo. It's called Gulf States Gems, where we shout out a special person or place or event in our Gulf South region that we just love. So I'll go first. I'd like to shout out Nellie's Chicken and Daiquiris, no relation to me, in Hattiesburg, Mississippi, who so graciously catered our listening session at Moore's Bike Shop. What about you, Tina? Who's your gem?
Well, so I haven't visited in person, but I really want to shout out the team at Cafe Beignet on 311 Bourbon Street, specifically Kevin Clark. Our Center for Health Journalism hosted a morning breakfast, of course, last June for the IRE conference, and they hosted more than 30 people. They're absolutely a dream to work with, even though I was here in Los Angeles. But the 30 plus people who joined them on the terrace had a lovely New Orleans themed brunch, and I can't wait to um, see them in person and see that beautiful terrace. I heard the beignets were just delicious. So many thanks to them for hosting a memorable event for the journalists who joined them.
That's wonderful, Tina. Sounds like a true gem. All right. Well, thank you so much for being with us today.
Thank you.
This week's show is cooked up by the Gulf States Newsroom team. Our theme music is by DJ Supreme. Special thanks to our partner stations, WBHM, Mississippi Public Broadcasting, WWNO, and WRKF. You can find us in your podcast feeds every Friday. Look us up and be sure to subscribe. Again, I'm your host, Elise Gregg. Thanks for listening, and don't forget to stir your brew.